Do you ever just feel off? Maybe it's a nagging thirst that you can't seem to quench, no matter how much water you chug. Or maybe it is an exhaustion that clings to you like a heavy blanket, a bone-deep weariness that no amount of sleep can fix. These aren't just signs of a busy life. They could be your body sending out a critical warning, whispers that can grow into a roar if you don't listen. According to the CDC, millions of people are living with diabetes and don't even know it. Even more have prediabetes, a serious condition where blood sugar is higher than normal. And for the vast majority, over 80%, they have no idea. The symptoms are your roadmap, and it's time to learn how to read them. Today, we are going to talk about 10 of the most important early warnings your body sends when diabetes might be on the horizon. We're not just going to list them. We're going to explore what each sign really means, why it's happening, and how it might show up differently for men, women, and at different ages. This isn't about causing alarm, it's about giving you power. Knowing what to look for is the first and most vital step toward taking control of your health. So many people brush these symptoms off as minor annoyances or just part of getting older. But ignoring them can open the door to serious health problems, including heart disease, stroke, and kidney damage. The good news: early detection changes everything. Especially in the prediabetes or early type 2 stages, you have a real chance to turn things around. Lifestyle changes can make a huge difference, sometimes even reversing the condition's course. So, let's listen to what your body is trying to tell you. Stick around as we count down the 10 early signs of diabetes you really shouldn't ignore. Sign number 1. First up is one of the most classic signs of diabetes: needing to pee all the time. Medically, this is called polyuria. It's easy to dismiss. Maybe you've just been drinking more water, or maybe it's all that coffee. But in the context of diabetes, we're talking about a real, persistent increase in bathroom trips, especially if it starts waking you up at night. The average person urinates about 4 to 7 times a day, but someone with high blood sugar might go a lot more often. So, what's going on inside your body? It all comes down to sugar, or glucose. Normally, your kidneys are like a super smart filtration system. They pull glucose out of the fluid that passes through them and send it back into your blood. But when you have diabetes, too much glucose builds up in your blood. Think of your kidneys as having a max capacity for sugar. When your blood sugar level goes over that limit, your kidneys just can't keep up. They get overwhelmed. To handle this sugar overload, your body kicks into emergency mode. It flushes the extra sugar out through your urine. To do this, it has to pull extra water from your tissues to make enough urine to carry all that sugar away. That's what causes the frequent, urgent need to go. It's not in your head. Your body is working overtime, trying to get your blood sugar back in check. This sign can look different, depending on the type of diabetes. In type 1, the need to urinate often comes on suddenly and can be dramatic. A child who's been potty trained for ages might suddenly start wetting the bed. For an infant, parents might notice a huge increase in wet diapers. The change is usually so abrupt it's impossible to miss. In type 2 diabetes, however, the change is much sneakier. You might just find yourself heading to the restroom a bit more often over weeks or even months. It's so subtle that you can get used to it, thinking it's your new normal. You might blame it on getting older or having a small bladder. This slow creep is why type 2 diabetes is often called a silent disease at first. For older adults, this symptom is especially easy to overlook. Getting up at night to pee is often just chalked up to age, or, for men, prostate issues. While those can be factors, it's vital not to dismiss high blood sugar, especially if other signs on our list are present. If you've noticed you remaking way more trips to the bathroom than you used to, day and night, that's a signal worth talking to your doctor about. Sign number 2. And right on the heels of frequent urination comes our second sign, an intense, often unquenchable thirst. This is not the normal thirst you feel after a workout. This is a nagging feeling of dryness and an overwhelming desire to drink, even when you feel like you've been drinking constantly. The reason for this is a direct result of all that peeing we just talked about. Remember how your kidneys are pulling water from your body to flush out sugar? Well, that process can lead to dehydration. Your body is losing more fluid than it's taking in, and your internal hydration alarm starts blaring. That alarm is what you feel as intense thirst. Your brain is sending a powerful signal, begging you to replace the fluid you're losing. You guessed it, even more peeing. Many people get trapped in this loop, not realizing an underlying issue is driving it. They might start chugging water, but if the root cause is high blood sugar, the thirst won't go away. In type 1 diabetes, this thirst can hit fast and hard. A child might suddenly start begging for drinks, waking up at night crying for water, or even drinking from a garden hose because the thirst is so powerful. This is often a key symptom that sends parents rushing for medical care. With type 2 diabetes, the thirst is usually much more subtle. You might find yourself carrying a water bottle everywhere, something you never did before. You might have a constant cotton-mouth feeling that nothing seems to fix for long. Because it creeps up slowly, you might just think the air is dry or you're not drinking enough. It's also important to think about what you're reaching for. If you're trying to quench this thirst with sugary sodas, juices, or sweet tea, you're actually making things much worse. It's like trying to put out a fire with lighter fuel. These drinks dump even more sugar into your bloodstream, cranking up the whole cycle of urination and thirst. The key is to ask yourself if your thirst feels out of proportion. Are you drinking gallons of water a day and still feel parched? That's your body sending a clear signal that something is seriously out of balance. This is not just regular hunger. It is an intense, persistent feeling that you are never truly full. Either way, the result is the same. Glucose cannot get into your cells. It is stuck in your bloodstream, causing high blood sugar. Your cells, meanwhile, are starving, even though they are surrounded by fuel. These starving cells send desperate signals to your brain, telling it you need more food. Your brain, thinking there's a fuel shortage, makes you feel intensely hungry. In early type 2 diabetes, the hunger might be more subtle. It may show up as intense cravings for carbs and sugary foods. That is your body instinctively reaching for the quickest possible energy source to feed its starving cells. This can create a vicious cycle where sugary foods spike your blood glucose, causing a crash that triggers even more intense cravings. If you find your hunger has ramped up and you never feel satisfied after meals, especially if it is paired with that endless thirst and urination, it is a powerful trio of symptoms that needs a doctor's attention. Sign number 4. The fourth sign is a deep, persistent fatigue. This is not just feeling tired after a long day. This is a draining exhaustion that makes even simple tasks feel like climbing a mountain. It is a weariness that does not go away with rest, and it is one of the most common and most overlooked early signs of diabetes. The reason for this exhaustion is directly tied to the same problem causing extreme hunger. Your cells are not getting the glucose they need for energy. Glucose is the main fuel for every single cell in your body. When insulin is not working right, that fuel cannot get where it needs to go. Your cells are running on empty. Imagine your body is a car with a full tank of gas. That is all that glucose in your blood, but a clogged fuel line, the insulin problem. No matter how much gas is in the tank, the engine sputters and stalls. That is exactly what is happening inside your body. You are eating, but the energy is not getting to your cells, so you feel constantly weak and tired. Dehydration makes it even worse. The process of flushing out all that extra sugar uses up a ton of water, and dehydration is a major cause of fatigue. On top of that, your kidneys are working overtime to filter the sugar, which burns even more energy. This exhaustion can feel even worse right after you eat, especially a meal high in carbs. It seems backward, right? Food should give you energy. But when you have insulin resistance, a big carb-heavy meal causes a massive blood sugar spike that your body cannot handle. The glucose stays in your blood instead of fueling your cells, and your body's struggle to deal with it is incredibly draining. In type 1 diabetes, the fatigue usually comes on fast and is severe. A once active person may suddenly become lethargic and too tired for their usual activities. In type 2 diabetes, the fatigue is a slow burn. It creeps in so gradually that it is easy to blame it on something else: stress, aging, or bad sleep. Many people live with this debilitating fatigue for years, accepting it as their new normal. If you are tired all the time, no matter how much you sleep, and it is getting in the way of your life, it is a huge sign that your body's energy supply chain is broken. You might notice your eyesight seems to go in and out of focus. This does not just mean you need new glasses. It can be a direct result of high blood sugar. The main reason for this is the effect high glucose has on the lens of your eye. The lens is a clear structure that bends to focus light. When your blood sugar is high, it can cause the lens to swell up with fluid. This swelling changes the shape of the lens and messes with its ability to focus properly. Because your blood sugar can go up and down during the day, the swelling in the lens can change, too. So, any change in your vision, especially if it is blurry and fluctuates, should be taken seriously. It could be your eyes giving you a clear window into your health. Stay safe, and we will see you in the next part. Let's talk about sin number 6, which takes us right to the ends of your nerves. I'm talking about a feeling of tingling, numbness, or that pins and needles sensation, usually in your hands and feet. This is a classic sign of nerve damage, known as diabetic neuropathy. While many people think of this as a long-term complication, it can absolutely be an early warning sign. So, why does this happen? Your nerves need a constant supply of oxygen and nutrients, which they get from your tiniest blood vessels. But chronically high blood sugar is toxic to both your nerves and these blood vessels. It damages them, so they can't deliver enough oxygen-rich blood. Over time, this literally starves the nerve fibers. The damage starts with the longest nerves in your body, the ones that travel all the way to your hands and feet. That's why you feel it there first. This feeling can be different for everyone. For some, it's a mild tingling, just like when your foot has fallen asleep. For others, it can be a burning or a sharp, shooting pain. Some people experience a slow, creeping numbness that makes it hard to feel the ground when they walk, or to do delicate tasks like buttoning a shirt. That loss of sensation is especially dangerous because you might not even notice an injury. Neuropathy almost always comes on gradually, which makes it a more common early sign in type 2 diabetes, a condition that can fly under the radar for years. You might only notice the tingling at night at first, but over time, it can become more constant. This is a sign of progressive damage to your nervous system. While there are treatments to manage the symptoms, the absolute best approach is prevention by getting your blood sugar under control. If you're experiencing persistent tingling, numbness, or a burning sensation in your hands or feet that you can't explain, consider it a major red flag. Your nerves are sending out an SOS. Now for our 7th sign. This one is subtle but very serious. Cuts, bruises, or sores that take forever to heal. Maybe a paper cut that used to be gone in a day or two now sticks around for a week. Or a blister you got from new shoes just refuses to go away. This slow healing is a direct result of the damage high blood sugar does to your body's circulation and your immune system. There are 2 main reasons for this. First, as we just discussed, high glucose levels damage your blood vessels. This leads to poor circulation, especially in your feet and lower legs. Good blood flow is absolutely critical for healing. It brings the oxygen, nutrients, and immune cells needed to fight infection and repair tissue. When your circulation is bad, the body's repair crew can't get to the injury site efficiently. Second, high blood sugar weakens your immune system. It makes your white blood cells, which are your first responders against bacteria, sluggish and less effective. So, you're left with a dangerous combination. A wound that is slow to heal because of bad circulation is also more likely to get infected because of a weakened immune system. This sign is especially dangerous when it comes to your feet. Because of potential nerve damage or neuropathy, you might not even feel a small cut or a blister on your foot. An unnoticed, untreated wound with poor circulation is a recipe for disaster. It can turn into a deep sore called an ulcer, and in the worst cases, can lead to infections so severe that amputation becomes necessary. Like many type 2 symptoms, the change in your healing time is gradual. You might not connect the dots at first, but if you see a consistent pattern of slow healing, it's a clear clue that your body's internal repair systems are struggling. It's a visible sign of a much deeper problem. Moving on to our 8th warning sign, getting infections more often. Do you feel like you're catching every single cold that goes around? Or more specifically, are you struggling with recurring urinary tract infections, also known as UTIs, yeast infections, or skin infections? This happens because high blood sugar is compromising your body's defenses. The main reason is that high levels of glucose create a five-star hotel for bacteria and yeast. Sugar isn't just fuel for our cells, it's also fuel for pathogens. A body with high blood sugar is like a petri dish for unwanted germs. This is especially clear in the urinary tract. As your kidneys work overtime to flush out extra sugar, your urine becomes loaded with it. This sugar-rich urine is the perfect breeding ground for bacteria, leading to more UTIs. If you find yourself getting them over and over again, it could be a sign of diabetes. Yeast infections are also very common, particularly for women. Yeast feeds on sugar, so high glucose levels can lead to yeast overgrowth, causing frequent vaginal yeast infections or oral thrush. While anyone can get a yeast infection, getting them repeatedly is a big red flag for high blood sugar. Because of their anatomy, women are more prone to both UTIs and yeast infections. So for them, a sudden increase is a really important early sign to pay close attention to. Beyond these specific infections, your general immunity is lowered. High blood sugar impairs your immune cells, making you more vulnerable to everything from skin infections to gum disease. If it feels like you're always sick, you need to ask why your defenses are down. Recurring infections are your immune system's way of telling you that something is fundamentally wrong inside your body. If any of these signs sound familiar, it's so important to talk to a doctor. Early detection and management can make all the difference. Thanks for watching, and if you found this helpful, be sure to like and subscribe for more health insights. Now, to the next part. Sign number 9 might seem like good news at first, losing weight without even trying. In our culture, shedding pounds without changing your diet or exercise can feel like a win. But when it happens, along with other symptoms, like extreme hunger and thirst, it's a very serious warning sign. This unexplained weight loss is a direct result of your body's inability to use glucose for energy. Let's go back to our fuel analogy. If glucose can't get into your cells, your body thinks it's starving and switches to its backup plan. It starts breaking down fat and muscle at a rapid pace for an alternative fuel source. So, even though you might be eating more than ever because of that intense hunger, your body is simultaneously burning through its own tissue for fuel. This results in a net loss of weight. You are literally losing body mass, both fat and muscle, because your body is consuming itself for energy. This kind of unexplained weight loss is a classic, and often dramatic, sign of undiagnosed type 1 diabetes. It can happen fast, with someone losing a lot of weight in just a few weeks, despite having a huge appetite. This rapid wasting is a clear signal that the body is in a metabolic crisis from a total lack of insulin. In type 2 diabetes, unexplained weight loss can also happen, but it's usually less dramatic and more gradual. It's actually more common for people in the early stages of type 2 to be overweight, as that's a major risk factor. But if someone with risk factors for type 2 starts losing weight without trying, it should be investigated immediately, as it could mean the disease is progressing. The key word here is unexplained. If you've started a new diet or workout plan, weight loss is expected. But if the pounds are dropping off while you're eating the same or even more, your body is screaming for help. It's never a good sign, and it requires an immediate trip to the doctor. Sign number 10. Our final sign is one that hits your emotional state. Noticeable mood changes, like being more irritable, anxious, or having symptoms that feel a lot like depression. It's easy to blame a bad mood on stress or a lack of sleep. but these emotional shifts can be directly tied to the roller coaster of your blood sugar levels. They might suddenly become cranky, weepy, or have behavior problems at school that are totally out of character. If you've noticed a real, persistent negative shift in your mood, especially if it's paired with any of the other 9 signs we've discussed, it's worth considering that the root of the problem might be physical, not just psychological. Your mood is a powerful barometer for your physical health. So there you have it, 10 critical early warnings of diabetes. From the constant thirst and bathroom trips, to the confusing mix of intense hunger and weight loss, from blurry vision and tingling nerves to slow-healing wounds and a mood that just won't lift. These are not random annoyances. They are connected signals from a body in distress. They are your early warning system, and ignoring them can lead to serious, even life-threatening, complications. Now, having one of these symptoms doesn't automatically mean you have diabetes. But if you recognize a pattern, if several of these signs sound familiar, are persistent, and are a change for youth, that's your cue to take action. The most important thing you can do is talk to your doctor. A simple blood test can give you a clear answer. Early diagnosis is everything. Over a third of American adults have prediabetes, but the overwhelming majority, more than 80%, don't even know it. This is a golden window of opportunity. For many people, a prediabetes diagnosis can be reversed with lifestyle changes. Losing even a small amount of weight, eating a balanced diet, and getting regular exercise, like a brisk walk for 150 minutes a week, can cut your risk of developing type 2 diabetes by more than half. Of course, this information is not a substitute for professional medical advice. Always talk to your doctor about any health concerns. Your health is your most important asset, and listening to your body is your most important skill. If this was helpful or made you think of someone you know, please give it a thumbs up and share it. You never know whose life you might change. For more helpful content about your health, don't forget to subscribe. Take these signs seriously. Take your health seriously. Make that appointment. You have the power to change the outcome.